Hello, welcome to my student support system. In today's class, we will discuss about muscles of upper arm or we can say hand. This lecture is in English and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture or you can directly visit to channel my student support system. In previous lectures, we have already discussed the muscles of abdominal cavity, chest cavity, head and neck, and general introduction about muscles and muscular tissue. This is lecture number 4 of this muscular systems lectures. Here we are going to discuss about the muscles of upper limb. So first muscle in the upper limb is pectoralis major. This muscle arises from the clavicle, sternum, and second to sixth rib and inserts into the greater tubercle and lateral lip of the intertubercle sulcus of the humerus. These muscles help in abduction like this, medial rotation, flexion of the humerus at shoulder level. This muscle is innervated by pectoral nerve. Next muscle is Latissimus Dorsi, which is situated mainly at the back. This muscle arises from the spines of T7 to T12 vertebrae, lumbar vertebrae, crest of sacrum, ilium and 4 lower ribs and insert into the intertubercle sulcus of humerus. These muscles help in adduction, medial rotation and extension of the humerus at the shoulder joint. This muscle is innervated by thoracodorsal nerves. Next one is deltoid. This muscle arises from the clavicle and acromion process of the spine of scapula and inserts into the deltoid tuberosity of humerus. Here, this one. These muscles help in abduction, medial and lateral rotation, and flexion and extension of the humerus depending upon which fibers are acting. This muscle is innervated by axillary nerves. And when we give IM injection in the arm, this is given in the deltoid muscle. Subscapularis. This muscle arises from the subscapular fossa of the scapula and insert into the lesser tubercle of humerus. These muscles help in the medial rotation of the humerus and this muscle is innervated by subscapular nerve. Supraspinatus. This muscle arises from the supraspinous fossa just above the spine of scapula and insert into greater tubercle of humerus. These muscles help in abduction of the humerus at shoulder joint and this muscle is innervated by subscapular nerve. Infraspinatus. This muscle arises from the infraspinous fossa of scapula and insert into greater tubercle of the humerus. These muscles help in lateral rotation of the humerus at shoulder joint. This muscle is innervated by suprascapular nerve. Teres major. This muscle arises from inferior angle of the scapula and insert into medial lip of intertubercular sulcus of the humerus. These muscles help in medial rotation of the humerus, adduction and extension at shoulder joint. This muscle is innervated by lower subscapular nerve. Teres minor. This muscle arises from inferior lateral border of the scapula and insert into the greater tubercle of the humerus. These muscles help in lateral rotation of the humerus and extension at shoulder joint. This muscle is innervated by axillary nerve. Corepobrachialis. This muscle arises from the coracoid process of the scapula and insert into the middle of medial surface of the humerus. These muscles help in flexion, adduction at the shoulder joint. This muscle is innervated by musculocutaneous nerve. Biceps brachii, or normally we call it biceps. As indicated by its name, it has two heads of origin. Long head originates from the tubercle above the glenoid cavity of scapula, and short head originate from the coracoid process of the scapula and insert into radial tuberosity of the radius. It is a strong muscle which covers front portion of the arm here. These muscles help in flexion at elbow joint, flexion at shoulder joint, spination at radio-ulnar joint. This muscle is innervated by musculocutaneous nerve. Next one is brachialis. This muscle originates from the anterior surface of the humerus and insert into the ulnar tuberosity and coronoid process of the ulna. This muscle help in flexion at elbow joint. This muscle is innervated by musculocutaneous and radial nerves. Brachioradialis. This muscle originates from the lateral border of the humerus and insert into radius just superior to the styloid process. This muscle helps in flexion at elbow joint and also moves the radio-ulnar joint. This muscle is innervated by radial nerve. Triceps brachii. As indicated by its name, it has three heads of origin. Long head originates from the tubercle below the glenoid cavity of the scapula. Lateral head and posterior, the lateral head originates from the lateral end, posterior surface of the humerus, and medial head originates from the posterior surface of humerus and insert into the olecranon process of ulna. These muscles cover the back portion of the arm here and help in extension at elbow joint, extension at shoulder joint, and this muscle is innervated by or controlled by radial nerve. Aconius. This muscle originates from the lateral epicondyle of humerus and insert into the olecranon process of ulna. This muscle help in extension at elbow joint. This muscle is innervated by radial nerves. Pronator Teres. This muscle originates from the medial epicondyle of the humerus and coronoid process of ulna and insert into mid-lateral surface of the radius, and this muscle help in pronation. This muscle is innervated by median nerve. Pronator quadratus. This muscle originates from the shaft of ulna and insert into shaft of radius. This muscle help in pronation and this is also innervated by median nerve. Spinator. This muscle originates from the lateral epicondyle of humerus and from a ridge near radial notch of ulna and insert into lateral surface of radius. This muscle help in supination and it is innervated by deep radial nerve. Flexor carpi radialis. This muscle originates from the medial epicondyle of humerus and insert into second and third metacarpal. This muscle help in flexion, abduction at wrist joint. This muscle is innervated by median nerve. Flexor carpi ulnaris. This muscle originates from medial epicondyle of the humerus and superior posterior border of the ulna and insert into the pisiform, hamate and fifth metacarpal. And this muscle help in flexion at and adduction at wrist joint. This muscle is innervated by ulnar nerve. Palmaris longus. This muscle originates from the medial epicondyle of the humerus and insert into flexor retinaculum and palmar aponeurosis. This muscle help in flexion at wrist joint like this, and this is innervated by median nerve. Flexor digitorum superficialis. This muscle originates from the medial epicondyle of the humerus and coronoid process of ulna and insert into middle phalanx of each finger. Here, this muscle help in flexion at proximal interphalangeal joint, metacarpophalangeal joint and wrist joint. This muscle is innervated by median nerve. Flexor pollicis longus. This muscle originates from the anterior surface of the radius and interosseous membrane and insert into base of the distal phalanx of thumb. Here, this muscle help in flexion at interphalangeal joint of the thumb, and this muscle is innervated by median nerve. Flexor digitorum profundus. This muscle originates from the anterior and medial surface of the ulna and insert into the base of distal phalanx of each finger. Here, this muscle help in flexion at distal proximal interphalangeal joint and wrist joint also, metacarpophalangeal joint also, and this muscle is innervated by median and ulnar nerves. Extensor carpi radialis longus. This muscle originates from the lateral supracondylar ridge of the humerus and insert into second metacarpal. This muscle help in extension, abduction at wrist joint, and this muscle is innervated by radial nerve. Extensor carpi radialis brevis. This muscle originates from the lateral epicondyle of humerus and insert into third metacarpal. This muscle help in the extension and abduction at the wrist joint, and this muscle is innervated by radial nerve. Extensor digitorum. This muscle originates from the lateral epicondyle of humerus and insert into distal and middle phalanx of each finger. Here, this muscle help in extension of the distal and middle phalanges of each finger and extension at wrist joint. This muscle is innervated by radial nerve. Extensor digiti minimi. This muscle originates from the lateral epicondyle of humerus and insert into tendon of the extensor digitorum on little finger, and this muscle help in extension of proximal phalanx of the little finger at metacarpophalangeal joint and extension at wrist joint also, and this muscle is innervated by deep radial nerve. Extensor carpi ulnaris. This muscle originates from lateral epicondyle of the humerus and posterior border of ulna and insert into fifth metacarpal. This muscle help in extension and adduction at wrist joint. This muscle is innervated by deep radial nerve. Abductor pollicis longus. This muscle originates from the posterior surface of radius and ulna and insert into the first metacarpal, and this muscle help in extension and adduction of the thumb. This muscle is innervated by deep radial nerve. Extensor pollicis brevis. This muscle originates from the posterior surface of radius and insert into base of the proximal phalanx of the thumb, and this muscle help in extension of the proximal phalanx of thumb, and this muscle is innervated by deep radial nerve. extensor pollicis longus. This muscle originates from the posterior surface of ulna and insert into the base of distal phalanx of the thumb. Here. This muscle helps in extension of the distal phalanx of thumb, and this muscle is innervated by deep radial nerve. Extensor indicis. This muscle originates from the posterior surface of the ulna and insert into tendon of extensor digitorum of little finger. This muscle help in extension of little finger like this. This muscle is innervated by deep radial nerve. Thank you students for watching such videos. For the latest updates, you can like Facebook page, you can subscribe the channel, and you can join Facebook group Nursing Notes. Thank you. Have a nice day.